About 160,000 people die of lung cancer each year. About 85 to 90% of that cancer can be attributed to active smoking. The other 10 to 15% are caused by factors other than active smoking. If we took lung cancer in never smokers, the term for people who never smoked, it would represent 16 to 24,000 deaths per year, a major cause of cancer death.
So secondhand smoke is a term used for the smoke coming off the lit end of a cigarette. And it was really not until about 1986 when the Surgeon General report came out on the dangers of secondhand smoke. Before that, they knew that cigarette smoking was bad, but it was really the mid-'80s when the Surgeon General first came out. C. Everett Koop, who just recently passed away at the age of 96, came out saying about the risks of secondhand smoke. So that's why you've seen a lot more policies around secondhand smoke and trying to protect people from secondhand smoke. Secondhand smoke is made up of over 40 carcinogens. So cancer-causing agents. Secondhand smoke is a Class A carcinogen, meaning there's no safe level of exposure to secondhand smoke. And also, there's many different chemicals, over 200 some chemicals in cigarettes and cigarette smoke as well in the tobacco. So like acetone, some of those dangerous chemicals that you wouldn't even think of inhaling or doing straight, but they're in the tar and the nicotine and the chemicals in secondhand smoke. Yeah, I mean, when you look at it, secondhand smoke is third leading cause of death. Around 53,000 estimated deaths per year due to secondhand smoke. Whether that has been, working in an environment where smoke was present, living in an environment where your significant other or spouse smoked. Children are much more susceptible. You can think how small they are and how much more it would affect their lungs and impact them, not necessarily only as kids, but also as they get older as well. And you think of asthma, you think of people with lung cancer, heart disease, all attributed greatly to secondhand smoke exposure.
My name is Dr. Tim Leyden, and I'm the anatomy physiology professor here at University of Wisconsin River Falls. I've been asked to come and talk to you a little bit about the effects of smoking, and with an emphasis and focus a little bit on the idea of secondhand smoke. The issue of cigarette smoking is a very major one that involves the respiratory tract going from the mouth and nose all the way down into the lungs of the body. And so the lungs are going to be the major place where impacts from cigarette smoke are going to occur. But those aren't the only places that cigarette smoke affects. Cigarette smoking can affect a large number of different systems in the body. Why does it affect so many different systems in the body? That's a really good question. And the reason for that is because cigarette smoke contains about 7,000 different chemicals. Not one, not two. We hear about all the time nicotine and tars, quote unquote. But when we actually look at that chemically, we see that there are about 7,000 different chemicals in there. And of those 7,000 different chemicals, about 70 of those chemicals are actually cancer-causing agents. They will cause cancer when cells are exposed to them. 70 different chemicals out of 7,000. In addition to those effects, the direct chemical effects of cigarette smoke, there's another issue that comes into play, and that is that the respiratory system here, your lungs, are there for the purpose of exchanging oxygen with the environment. And the exchange of oxygen with the environment is done in order to provide your cells inside your body with the necessary gases to work, to live. So if you don't get enough oxygen, you're going to die. And the same thing applies to your cells. If they don't get enough oxygen, they're going to die too. Well, the problem with cigarette smoke, or a problem with cigarette smoke, is that it also contains a chemical called carbon monoxide. And carbon monoxide actually will bind to your red blood cells and to the hemoglobin in your red blood cells in your circulation, and when it binds to that, it binds better than oxygen does. So carbon monoxide actually will block oxygen from being taken up by the hemoglobin. So as you're smoking, you're actually reducing your body's ability to breathe for all intents and purposes. When we look at the effects of smoking, we can see, if we just talk about one kind of problem, we can look at lung cancer and see that there are approximately 220,000 new lung cancers every year in the United States. 27% of all cancer deaths are related to lung cancer. So this is a very, very major issue. When we talk about the effects of the chemicals on the body, this affects a lot of systems. The simple effects are things like lung cancer, and those are things that most people recognize. If you look up at the screen, you can see that we have an illustration up there, and some people might gross out and think it's a terrible illustration, but it's actually an excellent illustration because it shows you two sets of lungs and heart from cadavers. So these are human. They've been taken from the body after death. And on the left side of the screen, the pink coloration is a normal set of lungs from a normal individual and a normal heart. And you can see there's kind of a pinkish, tannish color, and it just generally looks pretty healthy overall. Next to that, on the right side of the screen, is a pair of lungs from an individual who was a lifelong smoker. Now, I have to admit to you, full disclosure here, that this is a person that probably smoked for 30 or 40 years before they died. And they also probably smoked a great deal because these lungs are extremely heavily impacted. But the purpose here is to illustrate to you what can happen in the most extreme cases. So notice, first of all, that the lungs on the right are black or blackened. And also notice that the color of the heart tissue is kind of yellowed. And that's actually a very good illustration of the fact that the effect of cigarette smoking is not just on the lungs. It's going to be on every system that's touched by the circulation. And the heart is the key pump for the circulatory system. So this is going to be a major impact. Notice also on this particular lung, the smoker's lung, right down along the edge here, if we look very carefully, right there, you can see there's some whitish coloration. That is almost undoubtedly areas where this particular lung had tumors, and so that represents lung tumor. You can also see some slightly whiter areas up in the rest of the lung area, rest of the lung tissue on that same side, which are probably also tumor areas. And not just cancers of the lung either. We focus on that, but cancers of the esophagus, the tube that runs down to your stomach, cancers of the trachea, so the stomach is down in this area. If we take the liver out, here's the stomach down here. We take our heart off for a minute. This tube right here is the tube that goes down to your stomach, the esophagus. This tube right here that you see branching, and that tube continues up into the throat up here, that's the trachea. The trachea can have cancers occur in the trachea, in the voice box in particular, right in this area. You can have vocal cord cancers, you can have cancers of the larynx, and that leads to the larynx having to be removed and people ending up having to speak through what's called a stoma, which is a pipe that comes straight out of the front of your chest. And you can train people to use that to express air and speak with it, but it's incredibly difficult and horribly painful and very, very unpleasant to have to live that way. So you can get cancers in those areas. You can get cancers of the esophagus back here going down into the stomach. You can get liver cancers from cigarette smoke. You can also get oral cancers where you get a cancer in your mouth associated with your tongue oftentimes, but also sometimes with the walls of your mouth, which can go into the bone and lead to removal of the jaw or other things like that. So it sounds horrible and terrible, and it really is horrible and terrible. The effects of cigarette smoking are extremely major. Regardless of how the chemicals get into your body, the major place that they get processed in your body is going to be in your liver, which is this organ that you saw me take out a little while ago relative to the stomach. So the liver is the processing plant for chemical detoxification. And as I said before, with 7,000 chemicals, 70 of which are carcinogenic, cancer-causing, there's going to have to be a lot of detoxification going on. The liver is going to have to work very, very hard. And liver cancers are one of the side effects of cigarette smoke. But in addition to liver cancer, if your liver is working that hard for things like detoxifying cigarette smoke, it won't be able to work as hard for detoxifying other things that might get into your body. And so you're going to negatively affect the liver through those kinds of approaches too. And then, as I said before, the lung, this is a model of the lung, and you can see here's the trachea coming down, branching off into the bronchi each side here, and one goes over, there'd be another lung over this side. Inside the lung, you can see here's where the airway goes down. Not uncommon for cigarette smokers to develop cancers associated with the places like right there where you see this branching. Those branch points are places where a lot of these chemicals build up, and those are very commonly places that people will develop lung cancers from cigarette smoke. You can see also that gray continues down and spreads out throughout the lung, and that's going down to little tiny air sacs inside the lung, millions of these little tiny air sacs inside the lungs. And that's where the oxygen is exchanged with the atmosphere. But that's also where the carbon monoxide gets across into the circulation. And the circulation, your blood supply running through your body, you can see in this model, that's very clearly illustrated with this red and blue right here. The red is the blood coming out of the lung, in this case, going back to the heart, and the blue is the blood coming from the heart that's been around to the tissues of your body. But the point here is you see it come in and branch just the same way as the airway branched, and it branches down to those little tiny air sacs. And every single one of those air sacs is surrounded by a set of vessels called capillaries. And those vessels surrounding the air sac are the place where gas moves back and forth from the atmosphere. And that gas can be good things like oxygen or negative things like carbon monoxide.
Smoking is only allowed within, I think it's 200 feet of a building. You've already seen those posters up. And I think what's going to happen is you'll see a campaign of posters around campus, in the student newspaper, in the local papers, for community members also, that they kind of know that we're tobacco-free campus. So I know introduction with the new students coming in, that'll be something that's been emphasized. It was talked about this past year, so all incoming students know this is going to be taking place, so they won't be surprised. It's really more for students and faculty and staff who are already on campus, just to get the word out to them. I hope that people embrace this policy. I'm excited about being on campus, kind of out in front on this health issue. Again, we're trying to do things to help individuals become more healthy, whether again it's students, faculty, community members visiting campus, and so I'm excited and I hope that everyone gets on board with this. Thank you.
I'm Jenny. I've been smoking for about 1.5 years now, and when I smoke, I try not to smoke around other people so it affects them negatively. I know that's a choice I make, but I don't want it to impact others' lives.
Secondhand smoke. Well, I mean, I would never smoke in an enclosed area, inside a building, in wherever there's no smoking signs. I would never smoke there. I feel bad for secondhand smoke that gets into people's lungs when they're standing near a smoker. I believe in having areas designated for smokers. I feel that people who complain about secondhand smoke should do their best to not be around secondhand smoke, but smokers have rights as well. So I've been reading a lot in the newspaper here, a lot about how students are complaining about secondhand smoke. They're walking down the path and somebody in front of them is having a cigarette, and they're really upset because the air goes right into their... So I personally make an effort to smoke with certain types of winds. I'll go and stand on certain areas so that wind will blow my smoke out of the way of people. But once again, we're outside. So I don't really feel too bad for people who complain about secondhand smoke. Go stand someplace else. And usually I stand in designated areas for smoking. So walking down the path, I make an effort. I know a lot of other people may not make that effort to get out of the way of non-smokers. But I think smoking, I have the right to destroy my own body, and I'm doing it in open air. So I shouldn't be told not to smoke.
And for smokers too, to avoid blowing smoke in non-smokers' face.
I guess just wanted to show with tobacco-free campus policy coming to UWRF July 1st, 2013. Cigarettes were picked up, about 5,525 cigarette butts were picked up in an hour time several years ago, just to show the litter and the amount of waste that cigarette butts and smoking and can cause. But there's a tobacco-free policy coming on July 1st on campus, and there'll be a lot of marketing and talk about that. There's over 700 and some smoke-free and tobacco-free campuses in the U.S., so we're following a trade here. And we also have quit kits available for students as well that provide a few options and resources to help them quit if they would like.